or vibrate. And then when you do have questions, we have these handy dandy little mics on our tables that we can just press them, so that way you'll come on the speakers to where our virtual listeners can also hear you as well. So with that being said, good morning. My name is Elizabeth Probst. I'm the Community Outreach Program Coordinator here at St. Jude, a part of the HIV Prevention and Treatment Program. Say that 10 times fast, especially when you're struggling with a cold. Thank you for everybody online and in person. And this is where I'm going to chime in with Quenisha with AETC. Are you on with us?
Yes, I am. Good morning. How are you? I hope you get to feel it better.
Thank you. Thank you. I'm going to go ahead and progress to your slides where we can go ahead and get the disclosure with AETC.
Okay, perfect. Thank you. Good morning, everyone. I'm Quenisha Sanders, the Tennessee Program Manager with the Southeast AIDS Education and Training Center. Just wanted to provide a little information about us. We are providing the continuing education credit for you all. So just a few disclosures. We are funded by a federal grant from HRSA. Just FYI, the views expressed by the presenters do not represent the official views of the federal government. So we have to put that out there. And then secondly, we also are providing a slew of continuing education credit ranging from dental, diet, psychology, social work. So if you are looking to achieve or receive those continuing education credits for attending today, please just complete the evaluation link that I'll put in the chat towards the latter part of this presentation. And if you have any questions, comments, or concerns, I will also put my email address in there as well. And I yield the floor back to Miss Elizabeth.
Thank you, Quenisha. Appreciate you as always. And I'll make sure everybody in the room gets her information, especially if you did not, for some reason, sign up to receive CEs for this session today. With that being said, we're actually going to move into the reason why we're all here. And so I'm going to do an introduction for our speaker. So Leisha McKinley-Beach, author, thought leader, inspirational strategist, trainer, and community organizer. Ms. McKinley-Beach is the founder and CEO of the Black Public Health Academy. Leisha also serves as a consultant who provides training on Black health issues, including HIV, medical mistrust, racism in public health, cultural humility, and community engagement. She has been fortunate to participate in nationally recognized projects such as PrEP in Black America, Gilead Sciences and Champions of Change, a celebration of Black women and change makers in HIV, Vive Risk to Reason's national movement to retire the word risk associated with sexual health for women, the campaign to address HIV among Black women, and initiatives to engage faith-based communities in the HIV response across the South. McKinley-Beach received her bachelor's degree, community health, from the University of Florida and her master's degree in health sciences, psychosocial health from the University of West Florida. Leisha is a 2023 inductee into the University of Florida College of Human Health and Human Performance Hall of Fame. So without further ado, please join me in welcoming Miss Lee.
Good morning. I'm trying to, I'm already connected with someone in the room. I am really excited to be here. It is really quiet in this room. And that's okay. It could be because y'all know everything. I'm just here to validate. And also, good morning to those online. I can't see you, so somebody make me accountable. No, I can't see them. Okay, they're waving. Okay. Make me accountable to include them. Their time is precious as well. So I'm excited to be here. This is my first time at St. Jude. And I am already an expert on which gates you can use. Gate 2 is under construction. Don't go to gate 2. Don't go to gate 2. We're going to be talking about something that is familiar to you. We're also going to be talking about strategies to help us in scaling up PrEP for those communities that can benefit the most. This is something near and dear to me, and get the vibe it may be something near and dear to many of you. The fact that we are in an era in the HIV movement where we have a medical model to stop HIV from happening. That's super exciting to me. It's also heartbreaking to me that we have it, it's here, but we still struggling. We're still challenged. We're still trying to figure it out, how we get it to those communities that can benefit the most. Like Elizabeth, I too am getting over a cold, so forgive me. Okay, so forgive me for that scratchy sound. I think I just addressed all of what we're going to be talking about today. I do want to highlight medical mistrust. We're going to put a pin in that because that's also important for us to address. You can move on to the next slide. Some of you are sitting in here with some brilliant ideas on how we're going to scale this up. And I'm excited to hear from you about that. So I'm trying to find out who's in the room and who is on with us virtually. So I'm looking for a few singers, just a few. Who sing on Sunday morning? Who sound magnificent in the shower? I can't even get support from the virtual people. Okay. Who says if somebody sings, somebody starts it, I'll join in. Can I get that? Okay, I see that. No. Okay, Michelle. Okay, I see a few. All right. Okay, next piece. So I'm trying to find out who's in the room. So if you know, you click on the next one. Oh, okay. If you were in your 20s when this song came out, please feel free to join in the chorus and I'll know the age group of who I'm talking to next one. My Girl. Who sung it? Temptations. You notice she said, I know that one. I know that one. 1964. Anybody online can start us off?
About my girl.
I think I can. It was before my time, but if I'm not mistaken, does it start off with each day through my window? Oh wait, that's just my imagination. Just kidding.
We're gonna still give her an A for effort. What about I hear it on a cloudy day? Background.
When it's cold outside,
Outside.
I got the
I got the months of May.
Okay. You say
what can make
me feel this
way,
way,
my
my girl,
girl.
my girl. All right, I hear the altos, tenors, and sopranos. All right, so who really was in their 20s during this time? Nobody? All right, young people. Okay, anybody online?
No, ma'am.
Okay. All right, let's move on to the 70s. Anyone in their 20s in the 70s? Y'all, this young lady right here. Yes. Woo! That was enough. Awesome. Awesome. I will survive. And we are going to survive, by the way. We are going to survive. All right, where my 80s at? Oh, they down the back. That's where they are. Just wanna help. Yes, girls just want to have fun. All right, we're the young ones.
Want to be with my mother.
Yeah.
Taking it too
Yeah.
easy. Okay, sorry. I'm done.
You say I know it. I'm just not gonna sing it.
Guiltedly, I watch that movie religiously, like just about every single day. So I know every Spice Girl song. It's bad.
Okay, for the 90s. Now I know. It's better than yours. Yes. But I have to charge. Robin Bell gave us, oh, okay, I see a few hearts to that. Now, is there anybody younger than was in their 20s in the early 2000s in the room or on? Oh, really? Okay, young people. Let's just give them one more, Elizabeth. Just one more. No?
I hadn't quite hit 20.
Oh, wow.
Wait, no, I'm sorry. I was in my early 20s at that point.
Early 20s with Roar. All right, Katy
Perry,
Perry.
yep.
All right, awesome. So, let me just tell you a little bit about who I am. Who am I, Elizabeth? I am a woman of faith. I never separate that from the work that we do in HIV because I need that now more than ever, right? Connecting to that faith. Next one. My colors should give it away. You go on to the next one. I am a graduate from the University of Florida. I'm a proud graduate from the University of Florida. And I love Tennessee except for September to December. Don't call me then. After that, you got me all the time. SEC humor. I'm a storyteller. And so much of what I have experienced in this work, I started doing this work when I was 17. And this year, if I live to see Thanksgiving, I will be 52. So the majority of my life has been connected to HIV, and we'll talk about that through some of our work. Next one. I'm a Southerner, even with diction classes. As a college student, that Southern twang still comes through. I know I'm in good company. I can use y'all and don't nobody look up when I say it. And I take pride in that because where we see the epidemic of HIV in the South, there are also some great, dynamic, brilliant minds in the South that's working to address it. And I believe I'm in good company, both in this room and virtually. Okay. I'm an advocate. Michelle gives me the thumbs up to say, yes, I'm in good company. And I'm also an ally. There are times when we are forward as advocates, and there are times when we have to fall back as allies and support other communities that are also addressing this epidemic. Next slide. So let's talk about the Tennessee story. This is not going to be anything, late breaking for you. Anything that's on the screen that stands out to you, maybe that you didn't know. Did I hear somebody? Anybody online? Okay. So, yes?
Hit your mic so they can hear you too.
I'm sorry, I was just trying to see when the statistics were from.
2022.
Okay.
Okay. All right. Next slide. Let's look a little closer to home. So when we look at the top 5 counties in the state of Tennessee, any revelations up here? Is that what you expected to see? Okay. Now, my money goes to one of these counties, as my child is a student at Tennessee State um, University, but also my concern and interest about what's available to her in terms of her sexual health. Next slide. I want to show this. Anybody participated in this World AIDS Day event? Okay, I see in the back. I see a few people. Okay. Oh, and I see Elizabeth. All right. Anyone online? Okay. Well, you can put in the chat so we know that you were there. There's a quote in the announcement about this that I want to center. Miss Sanders says, I was there. Okay, awesome. Okay.
Department shows the metropolitan area of Memphis has it ranked second among all metropolitan areas in the country for new HIV infections. That's why the health department is seeking solutions this week through spreading awareness for HIV. Tomorrow over at the Atrium on Overton Square, you can join the Shelby County Health Department for their annual World AIDS Day observance. This event is free and open to the public, along with confidential HIV testing. The event will feature food, music, entertainment, and much more. And the latest data in Memphis shows that over 7,000 people are living with HIV. That makes 911 cases for every 100,000 people. The new diagnosis rate here in Memphis was 0.9% of the nation's new HIV diagnoses.
Okay. So when you saw that, when you heard that, and you were living that, what did it feel like to hear that out of all of the cities in the United States, Memphis ranked second in terms of new HIV diagnosis? What's that feel like?
It's not
I
a
heard scary. I heard sad. Yeah, you can come off mute. Those of you online, what does it feel like? What did it feel like?
shameful.
You're shameful.
However, I will
The
say
president.
Shelby County is the place to turn that number around. We can do it.
I'm not on camera.
She just took all my thunder for the rah-rah speech. That's why she should have sung Roar. But I digress. Yes. Uh-huh. What else? Someone online was speaking?
Michelle?
I said depressing.
Depressing. Can I say, as somebody who does not live in Memphis, when I first saw the CDC data, I thought that was wrong. Like, that can't be. Right? Like, that can't be right. Who back there, what EPIs are doing running the numbers? That can't be right. Not when, next slide, not when I see it next to the city before it and the city after it. Right? That can't be right. But as my colleague said in the back, we're not going to cry over spilled milk. It is what it is, but that gives a great opportunity to turn it around. It might mean doing more of what we are successful at. It also might mean we're having to reimagine how we do some things, right? We're having to prioritize some populations like women that might not have gotten our full share of addressing HIV. Any comments, thoughts so far? Yes, sir.
My thought is this. I believe Memphis It's the smallest city from Atlanta
That is correct.
and Miami. And I don't understand how our numbers can be so high and theirs lower.
You know, I started this by saying that the expertise was also in the room and online. So before I respond, any of our colleagues want to chime in on this? Memphis is smaller.
It is, but because of the ratio of the amount of the population versus new HIV diagnoses, it makes a higher rate.
Memphis is also unique because we have we're in what's a transitional grant area, so therefore it's not just Shelby County. It's governing counties next to us. So you have Fayette, Tipton, Tunica, Marshall, DeSoto, Crittenden. Please forgive me, anybody on here from Arkansas. I try to train myself to pronounce it right, but so one county in Arkansas. So I believe there's 7 counties altogether, but only 3 of those are here in Tennessee.
Okay. I would probably venture off to say that even with those other counties, that Miami-Dade and Atlanta probably still are larger, right? Okay. Anything else? What's similar with all 3?
African Americans.
Large Black populations. What else?
Metropolitan areas.
Metropolitan areas. What else? Y'all calling all of them.
South.
These are areas that are steadily growing and becoming more popular, especially Memphis with Glorilla now. So they're becoming very popular.
M-E. Okay. So growing, but Elizabeth says something that's very powerful, and that's what I want to center. They're all in the South. They are all in the South. So even with those additional counties, even with them being metropolitan areas, they're all in the South. What does that say about our geographic location? What's then fueling this? What's driving this?
High poverty.
Poverty? What else?
I want to say the lack in public health that we have in the South compared to other regions. It's really bad in this area.
So we are talking about those social determinants of health, right? And it says whether you in Tennessee or Georgia or in South Florida, that we're seeing some similar trends. Okay? All right, next slide. I know I'm here to talk about PrEP. We're getting there. Okay? This is testing data. Let's go to the next slide. I wanted you to see that number. Let's break it down. What does this say? And I do apologize, it's a little small. But when you get these slides, you can click on the link to AIDS View. If that's not something you have as a part of your resource inventory, I encourage you now to add AIDSview.org because it has some infographics and data that help us tell our story, right? So, and this is specific to the state of Tennessee. So if you could, see this, you'll see the purple line is showing the demographic group of people who have tested at least one time, right, in your state. And the grayish graph is looking at the number of people newly diagnosed with HIV. Okay, and so this is 2022. Anything stands out about sex to you, to those that can see? We see males who have tested at least one time at 36.9%, females who have tested at least one time, 39.4%. That sounds about right? Something stand out. Y'all talk back to me. I move faster when you talk back. Okay, so I'm assuming the silence says, yeah, that looks right to us. All right, let's look at race. 57.1% of Black people who reside in Tennessee have tested at least one time, 37% Hispanic, 34.2 white, 45.2 multi-race. That look right?
Yeah.
Okay. All right, let's go over here and break this down by age. Looks like
someone was trying to come off mute.
Okay.
Michelle, were you
No, I
trying
was just agreeing with her.
to? Okay, I just want to make sure I saw your box light up. That's why I was like, okay. Go.
So age, we see those 35 to 44 with the highest testing percentage, 56.9, followed by 45 to 54, followed by 45 to 54 at 52.4% testing. Look right? What story does this one slide tell us? Who's being tested in your state? I heard somebody say men. What else? What else can you add to the story? Black men? Okay. I framed it that way so that we begin to allow our data to help us tell the story. What story isn't told when you look at this?
There are certain groups, age-wise, ethnicity.
Yeah.
It's not shown up there.
So it could mean that there are efforts that need to be centered on younger people for testing. Yes.
When I take a look at the stats, and I see where as young as 13 years old, being they tested and diagnosed with HIV, it's upsetting. Something is wrong somewhere, especially at that age.
So I see a few head nods. Don't know if folks are agreeing online, but if we're seeing new testing happening and diagnosis occurring at that age, what stories could that also be telling us? Could be trauma. What else? Y'all, there are no wrong answers. It's okay. Talk to me. Could be access to testing. This could be an access story.
You do have a hand raised.
Okay, online.
I can say from experience when over 20 years ago, when we used to test younger people, we had several people come up positive that started at least 11 years old. They were positive and pregnant. So I just think they kind of need to reach a little bit more farther back than the 18. Is, you know, as far as having being raped or just having sex, period. I mean, it's out there, and these young kids don't know what to do.
So I'm seeing some support, Michelle, both online and head nods in the room. So how are you reaching them?
So I was going to say that a straight line to education.
Straight line to education. Okay. Are there any, I'm just going to throw some things out here. Yes or no, you don't have to keep up with my speed. Any testing programs in high schools? Any after school programs that center HIV testing?
Used to be here in Memphis. I used to be one of the testers in Memphis.
Yeah, they cut us out a long time ago.
They cut down.
I was gonna say I done heard in the room and I done heard online past tense. Past tense. We used to do this.
Well, we do have This is the Shelby County Health Department. We do have an MOU with Memphis Shelby County Schools right now to do testing, provide tools, provide resources, but that process has been slow and interesting to say the least. That's as much as I can say.
Okay.
And we are doing our part to move things forward. I'm not saying they're not trying to, but it's not just the school board. Parents have a real issue with other people touching their kids. If we can't get past that barrier, we cannot get these kids tested.
So first off, shout out to Shelby County Health Department. I know it sounds old school, but it is so innovative in this day and time because everywhere I go, I keep hearing people say, we can't do testing in the schools. We can't do education in the schools. You know, our school is abstinence plus, or our school is abstinence based.
So I will call attention to some of the comments in
Okay.
the chat. So we had Ty that mentioned stigma,
Mhm.
Robin who mentioned lack of sexual health education in schools, and then lastly, Lauren had mentioned the Bible Belt.
Okay.
I also want to add in there, I think there was a significant change after, during, and after the pandemic. When the pandemic occurred for COVID-19, everything shut down.
Okay.
That shut down ties, that shut down collaborations, that shut down a lot of things, and we're still coming back from it, in my opinion.
Okay. So we've mentioned all of these challenges, but I hope you all will acknowledge that in the midst of the challenges, you also started mentioning some solutions as well, right? And so even with the health department and the contract, it may be another year or two, but it's at least in process. What do you do in the meantime? I'm not asking that for group discussion, but I want you to challenge yourselves and your organizations. And what do we do in the meantime? Because the data says it's just not enough testing happening in your state for younger populations. Next slide. Okay, so we're going to our first poll question.
Press this.
Yeah, you can press it. If you will. Oh, looks like the question is gone. The question is, what can we do more about increasing HIV testing? Is that what's on the screen, Elizabeth? No, you can't see?
I'm stuck.
What does it say? Oh, that's the second one. It's all right. Go ahead and answer it. We're going to come back to it. Go ahead and answer it. Okay. You can either use the QR code or you can use the menti.com and then put the code 45800559 in. Okay. We're going to come back to stigma. Okay. We can move on. We're going to come back and see that one.
You mentioned there were two, right?
Yeah.
Okay, that was the only one that, yeah.
Okay. All right. Well, that's okay. Let's just make sure we're going into PrEP. I just want to make sure we all got a basic understanding about PrEP. To the folks who came in the room, there's, I think, lunch in the back. If you want to get lunch, those online, we're so sorry. We're so sorry. All right, next slide. PrEP basics. You all know this, right? What is PrEP? Can I get someone in the room to turn on their mic and read it for us? Okay.
PrEP stands for pre-exposure prophylaxis. Is medicine that reduces your chances of getting HIV from sex or injection drug use. When taken as prescribed, PrEP is highly effective for preventing HIV.
Okay, everybody knew that? Gotcha. All right, next slide. We got all these different options for PrEP, right? We got an oral option. We have an injection. I'm excited about. We have this injection every other month. I'm excited any day now. We could be hearing about the injection for twice a year. I'm also excited about a medication that was not for women, not for those assigned female at birth that may be approved by the FDA for women as well this summer. Right? So very exciting. Number of options growing. I can tell you that I got a call from the Georgia HIV hotline. This was a few years ago about these calls coming in from all over the state. From Hinesville, as one of our friends in the back was from Hinesville to Atlanta. And they said, what's going on? Because these, all the women that are calling in have the same question. Is PrEP for women? I said, oh, that's easy. I know what's going on. They up late watching their favorite show, and that's when this commercial comes on. And it says this medication is not for those assigned what? Female at birth. So to them, that is PrEP, right? Because they may not know of the other options that are available. Okay? But shout out to those who then thought, oh, they got a medication out I can take and prevent HIV? And let me call a reputable source to find out, is this real? And can women take it? Okay, next slide. I want to talk a little bit about this just because it keeps coming up more and more. And I will say that this model of 211 is not for women just because of the way that it is taken. It doesn't give enough time for medication to be within vaginal tissue for protection. How many people have heard of 211? Okay, what I tell you, I'm just here to validate what you already know, right? And so you have an individual who would take 2 pills, PrEP pills before 24 hours before sex, and then they take another pill 24 hours after that, and then another pill 24 hours after that. That's where you get the 211. Okay. Before we weren't hearing a lot about it, and now I keep hearing more and more about it. Next slide. Okay. Barriers to PrEP uptake. Is there something that is not on this list that you see as a barrier to PrEP?
People just don't know about it.
People don't know about it?
I'd say, of course, kudos to Shelby County Health Department. They've upped signage that's on the interstate where it's advertising for testing and things of that nature. But
oh, Shelby, okay.
That literally just rolled out this year compared to how many years PrEP's been out. Versus when you go to DC, I love going to DC because as soon as you come out and you're going on that escalator down, and big sign that talks about PrEP.
I was just in DC
and Vegas
this weekend.
Vegas. The big screens, it's so bright and pretty and just so inviting, and it's the norm. Oh, love it.
And then someone in the chat said perceived cost.
Perceived costs.
Jasmine.
I've seen stigma. A lot of people don't perceive themselves as vulnerable to HIV. Give 2 thumbs up to Cam because that's also where I was going with it. We gotta face the awareness. It's 2025. When did PrEP come out? 2012. And it's still people who don't know, ain't never heard of it. Yep. Think you mean prepping to get your children out your house for school. That's what PrEP means. That's exciting too. But
one we did miss was limited cultural and linguistical relevant information. That was also mentioned.
Thank you. Is that Estella?
Yes.
Okay. We're going to come back to that. Thank you for uplifting that. Yes, sir.
This is the Bible Belt.
Uh-huh.
I think that has a lot to do with it.
Mm-hmm. Yeah, because, we all wait till marriage to have sex. You know, in the words of Steve Harvey, if that's true, then where all these little Christians keep coming from, and you know, yeah. So we're in the Bible Belt. It is what it is, right? But it doesn't mean that we get to use that as our deficit. We got to find a way to be creative, even being in the Bible Belt. I remember one time my pastor in Atlanta wanted to do HIV testing. And he said, let's do, it's very few things that make me clench my pearls these days. You know, 34 years, I done heard it all. But he said, let's do testing during Easter. Totally. What you mean? And he said, and then people can leave saying the bishop gave us condoms. You know. But he was right. I wanted to know why. Out of all the days, why you choose Easter? It was like, because there. Yes. Christmas, Mother's Day, and Easter. Right? 3 times we get those bench warmers. Amen. Praise God. All right. All right, next slide. Okay. We're not going to break out into groups, but because I'm here to talk about women, I do want us to spend some time, give me 60 seconds talking about what medical mistrust looks like. And is that one of those barriers to women using PrEP? Why wouldn't women trust it?
I mean, you have the story of Henrietta Lacks. You have all these birth control pills with all the hormones, side effects I didn't know they would have. There's lawsuits with the birth control, people having babies, but they own birth control. There's a number of reasons that medical distrust is there. It may not be just for women, but what happened with the Tuskegee Airmen, and not all providers talk to their patients the way they need to. It's not a way that builds trust or rapport.
I have heard language. I have heard medical mistrust rooted in fact of what has happened to populations within our community, right? I want to talk about a civil rights leader who is near and dear to me. So much of my work I model after her, and that's Fannie Lou Hamer, who was down the street as one of your neighbors. How many people have heard of the Mississippi appendectomy? Okay. It was a way to control the Black population, that if a woman went into a hospital in Mississippi because her toe hurt, she was getting a hysterectomy, right? And someone as politically savvy and as knowledgeable as Fannie Lou Hamer wasn't exempt from the Mississippi appendectomy. So we have given reason, right? So then how do we counter that? So if Black women say, I know the stories, I've heard, they may not have it right, because what happened with COVID was the syphilis study in Tuskegee. And I say it that way because it was a government study that happened in Tuskegee. Why make the city of Tuskegee take all the shame and blame? This was a government study that just happened in Tuskegee. So when COVID came, Tuskegee probably got Googled more than any other time, right? People didn't have the information correct. We know what happened in Tuskegee because, they gave those men something and, killed them and all of this. And of course, that's not what happened. But they knew something happened in Tuskegee with Black men. And because of that, I'm not getting no vaccine. Right? And so we can't downplay the role that medical mistrust plays in people making decisions about medical care and treatment, even when we know that PrEP is 99.99% effective. Right? Yes, sir.
So we're actually talking about medical apartheid,
Okay.
right?
Yes.
Just one of the ways
Mm-hmm.
to keep, especially to keep our population growing with HIV and AIDS,
Mm-hmm.
which is sad.
Thank you. Thank you for sharing that. Yeah. Mm-hmm. Oh, your mic. Mm-hmm.
Like in the EDs as well, physicians and others are supposed to be doing care for everybody that comes through the emergency department, are supposed to be offering HIV testing. And so, that makes me too question, what's going on in the hearts and the minds of people. I mean, is it a matter of I'm too busy to deal with that, or I'm in here with this kid right now, I don't think they're at risk, all those assumptions and everything. So it just made me think of that.
And I appreciate you sharing that, because that is also what is happening. And I'll give you a perfect example. Anyone in here from Planned Parenthood? Okay. All right. So don't tell them I told the story. So a few years back, there was a PrEP pilot project with Planned Parenthood. And this was several Planned Parenthoods across the country, LA and Georgia, Alabama, like, a lot of different Planned Parenthoods, and they weren't all in the South. I was so excited to be a part of this study because I knew this is going to be the pilot right here. All we're going to have to do is take this and replicate it with health departments and CBOs. We got to win right here. Because why? Planned Parenthood, they see women. So this is going to be the PrEP pilot project for women. The study goes on, the data comes back, and the population that went from PrEP education to actually prescriptions overwhelmingly were men. And I thought, what the, can't say that for AETC. But the clinicians made some assumptions, right? If a same gender loving man came in the room, they saw them, they went from PrEP education to prescription, right? Women identifying one partner, not so much. But what do we tell women? Y'all talk to me, those that, counsel women with HIV testing, and they say, I don't really need a test. All I had is one partner over the past 10 years, right? They're confident. There are no risk factors there. What would you say? Come on, testers, old school testers. Tell me.
If you're having sex, you're at risk. So it doesn't matter one partner, you're at risk. So that's my main of telling women that they're at risk, and PrEP is a good option for them.
Okay.
Well, baby, how many partners they got?
Hmm?
And can you be sure?
Right.
Are you willing to stake your health on it?
Mm-hmm.
Well, come on, baby, let's get you prepped up.
Oh, yeah, that's old school.
Also, I will say to the last point that you made, one thing that we encountered was PrEP was thought to be a vaccination, which means y'all gonna shoot HIV in me?
Mm-hmm.
And no, I don't want that. And we had to debunk all of that. I was like, whoa, wait,
That's why the awareness is so important, right? When I first got married, one of the things that I told my husband was HIV testing is important to me, right? And so if it's important to me, I would hope it's important to you. But I'm not going to put my sexual health on hold we both get tested, and I chose a day. Anybody just want to take a guess when I chose when our testing day would be? Oh, that's a good one. No, but I heard World AIDS Day. No, where?
June 27th.
Yes, ma'am. June 27th, because that's what?
National HIV
So
Testing
there
Day.
is no excuse. We can find some free testing on June 27th, right? So don't come at me about the coins. One year I was traveling and for National Testing Day and we couldn't get tested together. I got tested later. He still hadn't been tested. So I told him, I said, and my favorite song in the world is Ribbon in the Sky by Stevie Wonder. And my husband is a musician. So he starts playing the song, and he's playing it loud. I'm like, I'm not moved by that. I really was, but I'm not moved by that, right? This is a commitment I have to keep for myself. I can't tell other women, to know their partner's HIV status and I not know my own. That was on a Friday. I got this call early Saturday morning, and I was like, who is calling me this early on Saturday? Answered the phone, hello? My husband said, baby, I'm at LabCorp, but it's closed. I learned then that I got the power, right? And we have to live in that power about our own sexual health. So now I don't tell women what they should do. I talk about what we can do. So fast forward 20 years later, this year, he got his test early because of a physical. Now, I don't know of any place that still provides paper results, but it lets you know how long he's been testing. He got his results electronically, and he said, I know my HIV status. You can't get none of this until you know your HIV status. Check 20 years later, what a change, right? But we've been consistent with HIV testing, and I promote that every year. I had someone say, I don't understand. Why do y'all get tested and y'all married? Right. Nobody asked me that about our glucose levels. Nobody asked us that about our cholesterol. And we both have to get that done every year. So why are we putting the stigma on HIV testing? And it's unnecessary. Okay, next slide.
Well, before we move on, I want to make sure that some of the comments got read out. So we had one comment that said medical mistrust has been a barrier for me to not seek out treatment, period. Feeling invalidated and dismissed during appointments with providers, especially in the South. Then we had another that mentioned, I would tell people that PrEP and HIV testing is a form of self-care and self-love. Taking these steps are critical into their health. And then lastly, we had NHTD, which I believe that was referring to National HIV Day.
Yes, thank you for that. I love framing it in the positive, Ms. Sanders, for self-care and self-love.
I'd like to add something. Can you hear me?
Yes. Uh-huh.
Okay. I just like to add something. I came in toward the kind of late getting on, but I know like I do fairs where we offer HIV testing, and I know like some people might not want to get the test because they say like, oh well, I know my status. We're faithful in this and that. And I said, well, that's great. And I said that to me is really a good reason to take this test, because that way you can show yourself that you can see that what you're saying is actually true, because the results will come out exactly like you're saying. So, and then on top of that, you get our gift card for doing the test that we offer in the center. So I still try to encourage them to do it, even though they say, hey, we don't need to do this. Still try to encourage them to do it and let them know that just shows that they're doing a great job at protecting themselves.
I love all these nuggets y'all are providing each other about the positive way to encourage people to get tested. National HIV Testing Day is literally just a few days away. What, June 27th, right? And so I hope that everybody is taking these excuse me, nuggets and words of wisdom. Okay, several times y'all have mentioned language. And so I want to take a moment and let's talk a little bit about language. We want to use language that is empowering, right, and respectful. I heard somebody in the room say that already, right? Let's go to the next slide. I want to share a couple of examples from the Well Project, and I added them in as your resource of what we should be saying, right? That is respectful, instead of some of the things that those of us who have been doing this work for a minute have literally grown up with. The one that I want to start with is HIV infected person. HIV infected person. If somebody was talking about you in that way, how would that make you feel? Y'all know she infected.
Like less of a person.
Like less of a person. Right? This one, I don't know where it came from. Full-blown AIDS. Is there a half-blown AIDS or something? Like, is that one not as bad? But,
Yeah.
you couldn't just have an AIDS diagnosis. It's full-blown.
Yeah, that was
AIDS.
what they used early when HIV, first came about. They didn't know what to say, so that's what they said.
Right, but now we do know what to say, Joyce. Right, and so we gotta train, and this is also important, and no disrespect to the OGs like myself, but we can still learn. Right, there's no reason why anyone should be using full-blown AIDS at this
That's
time.
right.
All right,
That's right.
I have a question.
Yes.
So for AIDS, like, are we still referring to it as AIDS, or what is it? The final state, late HIV, right?
So great question. So those online, the question was, are we even referring to it as AIDS? And there are some mixed reviews. There are some long-term survivors that say this is a part of who I am, right? I am somebody who has lived past HIV. I was diagnosed with AIDS, and taking that away is like taking a part of me. There are some younger advocates that will say the word is so stigmatizing. We are talking about people who are living with a virus, and so HIV is more fitting. I would say know the audience and be respectful of what the audience centers. Okay. All right, next slide. Any of these stand out to you? Let's just choose one more.
I just say I like the fact that it's highlighted HIV infections versus really the appropriate term now is transmissions. Because it's less stigmatizing.
I want to say one that is
Discordant. I mean, we shouldn't be using that with a consumer client because they're like, what?
So serodiscordant, meaning that, one partner is diagnosed with HIV and the other partner is not. Just that simple, right? I'm glad that you brought that up. I think serodiscordant is a term that's more, should be more utilized in settings like this with the academic and HIV workforce. Another term, I don't know, that's not up here, and I just want to leave it with you as food for thought. Our entire focus over the past couple of years has been ending the HIV epidemic, right? Anybody not heard of ending the HIV epidemic? Known to us as what? EHE, right? I had somebody come up to me. I've actually had several people in different settings come up to me and say that they don't like the term ending the HIV epidemic. Does that mean that you all want us to die off as people living with HIV? I never saw it that way. So I said, then give me a term that you feel. That's how we do it, right? We just don't not, we want to be solution oriented. Give me a term that you feel is respectful and still tells this story. We want to end new HIV diagnosis. I'll take that. And that's what you hear me say. Because we do get to the end of an epidemic by stopping new diagnoses from occurring. Right? That's part of what PrEP is all about. Okay? All right, next slide. We're running out of time. So we're not going to do this activity, but when you get these slides, I encourage you to do this activity with your staff or with colleagues. But I am going to say this, as Elizabeth mentioned in my bio, one of the things that I have also championed is retiring the word risk. As a woman, as a human being, as a Black woman, there is nothing risky about my body. That's going to be my contribution to ending new HIV diagnosis, is helping people understand all of this is not a risk. It's not a risk, right? But what I do need to do is assess what tools I can benefit from to remain free from HIV. Those who are living with HIV can assess what tools that they need. One, center themselves first for viral suppression. And then second, about how I can share information and be an ambassador for partners that may not be diagnosed with HIV. Those of you who have prevention programs, do not dismiss or overlook people living with HIV. Those are some of the best advocates for our prevention programs. Why? They got lived experience. What else? I'm going to take your comment a little further, because the path that you may travel, they have already been. They have already been. One of the things I'm going to leave you with is, what would it take for your yes for PrEP? Not the intervention, not the models that you saw somebody else doing. Right now, I want to center the most important client you will ever serve. That's you. What would it take for you to say yes? And when you figure that out, that's going to help other women say yes. Okay? Next slide. So I just want to leave you with, okay, have you encountered stigmatizing language related to HIV? Practically everybody who participated says yes. You know how that made you feel, right? One time, my husband got tested with his provider. We had the same provider. And I wrote this amazing satisfaction survey. I was so impressed. He didn't have to ask for it. You know, he let it roll off, just like he said, you get glucose, you know, triglycerides, HIV. He didn't skip a beat. Wasn't no separate consent form. I loved it. Then I went back. And yes, glucose, triglycerides, but he didn't mention HIV. And I said, I'd like to have an HIV test done. He picked up the chart and he starts flipping through the chart and he said, because he's confused because I asked for a test. So he flips through the chart and he says, oh, I'm sorry. I thought you were married. I am, to that same big dude that last week you told, he needed a test. You didn't even ask him. You just put it on the list. Right? Yes.
I have to ask for an HIV test every year. And my annual women's exam, I have to ask for one. They never include it. When I say I want STI checks, I have to say include the AIDS and syphilis. I have to ask for that. And I want to say a few things. The stigmatizing language. I've had to hear it about my child. My child was diagnosed at age 15. She is transgender, male to female. So I've heard a lot of stigmatizing language. And I want to say some things. These are my opinions. They're not facts. But, and maybe the health department can help me out with that. I want to say that there's 30,000 more women in Memphis than there are men. And I want to say that there are a population of grown people sleeping with young children. There is a link to substance abuse in that. And if we as parents don't take our blinders off and talk with our children, there cannot be privacy. You have to check the phones. You have to check the iPads. You have to check the computers. You have to check on your children, because if you do not, you will have a child that will come up with HIV and they don't know. Now, I'm a nurse. I've been one for years. So my child knew about protection. But when you get a child around a grown person, they're easily misled. My child wanted that acceptance, that validation of being a female. So there are grown men that she found online that pulled her in and gave her drugs. So we have to find a way to stop that, to find out how do we keep our children safe. We're in the day or age that people are gay, people are transgender, but these are our babies. We cannot throw them out on the street and let these people have them. And when I talk about the 30,000 extra women to men, we are sharing men, knowingly or unknowingly. And if some of these men are on the down low or trades or whatever, they're sleeping with these children and they're coming back home to their wives and they're giving, and their girlfriends. And then these people are contracting the HIV. And that is my story. Like I say, I don't know if all of it's facts, but this is what I deem to be what's happening and needs to be addressed. And I think it's called a syndemic.
Mm-hmm. Yeah. One, thank you for being vulnerable in the room and sharing, because when we do that, we learn from each other. That's one. That's two. And second, knowing that this is, I think, the third time we done been together an hour and 18 minutes, and youth have come up 3 times since I've been standing up here. It says something about those of you who are a part of HIV prevention planning groups, Ryan White groups, or what other group that's associated with HIV, that there has to be a strategy around what we're doing within the county to support young people across all genders, across all socioeconomic groups, because it's obviously important to you. That's why you keep bringing it up. So if not you, then who? Right? If not you, then who?
Online, we got a yep and then an amen, thank you. And that, as well as that's why we should be stressing personal accountability.
Okay. All right. Next slide. Okay, next slide. Okay, next slide. All right, I'm going to start here. What I'm going to do, 2 things, and we're going to do it in 5 minutes. One, this dynamic billboard that y'all was bragging about, shout out to Shelby County. I'd love to get a copy of that to add this to the list of programs that I have had a chance to see or be a part of across the country that's doing the thing to make sure that women become aware and informed about PrEP in the absence of a national campaign. I want to be watching a movie late night and the PrEP commercial comes on and it's all about women, right? And not women like I'm the home girl, or the good Judy, but I'm the woman that's in the relationship and we talking about PrEP. We still do relationships, right? I might have a hot girl summer and still do the relationship. You don't know, but I need that commercial to tell me you can do both, but let's talk about how you prioritize your sexual health in the midst of it. So this is the She's Well campaign. This campaign was created by CDC. This was intentionally around like the Instagram social media type campaign. Remember these images because we're coming back to that. Next slide. So CDC gave us some stuff to work with. This is probably the first original campaign, and this was from the Black AIDS Institute to promote PrEP among Black women. When we focus group this campaign, there were women across the country. We took these images to folks across the country. And as they looked at them, the first iteration of it was all the professional looking women, and people in the focus group said, we're the woman with the natural hair, right? Where's the woman that may have abilities that are different? Right? Why are we not highlighting her? And then my favorite, the one I'm striving to be like, is the sexy senior citizen on the bottom, right? Like she don't need information for her grandkids. It's a reason why Nana taking a cruise every summer. Come on now, right? She's still sexually active and thriving and living her best life, and she don't have a clue that PrEP is out there and available for her. Somebody said more women than men in the county, deacons and bishops, they just, never mind. All right, next slide. This is from Broward County. They took that campaign from the Black AIDS Institute and they made it their own. You've got the I PrEP because they made that whole campaign Black Girl Magic. I was so excited when I was visiting Fort Lauderdale and I saw this bus roll by. I was like, oh my goodness, right? This was their way of promoting PrEP for Black women. And those little commercials you see while you pumping gas, and putting $100 worth of gas in these SUVs, they actually turn that into a commercial. So while you standing there, don't have nothing to do, you get to watch this commercial to promote PrEP awareness. Next slide. This is Orlando. They campaigned PrEPalicious. It won the first PrEP Award for the MMEC Biomedical Prevention Summit. So the young lady that's at the bottom, she is a pharmacist by trade. And she said women kept coming into the pharmacy asking about PrEP. And she said, but the things like they were asking, information wasn't correct. So she partnered with the Orange County Health Department in Orlando, and they created this campaign, PrEPalicious. What's it a play off of? Bootylicious. All right, just checking. Make sure y'all still with me. Okay, next slide. Louisiana took, again, that same campaign, those images from the Black AIDS Institute, and they created their version of it with T-shirts and palm cards and backpacks and all of those things to promote PrEP among Black women. Next slide. And this is Georgia. And yes, we got to be a little different. home of the reality shows, right? Use what you got. And so we have Candy, who did a lot of work with the PrEP tour across the state of Georgia. And folks, women was coming out because it's like, oh, I get to see Candy for free, right? And they got there, and then they got the PrEP message. Now they also got some sex toy messages too, but I'm gonna digress. I'm gonna keep it moving. Keep it moving. Next slide. So Atlanta also has the Atlanta Black Women Leaders on PrEP. Next slide. And so this coalition created some palm cards, prepping women. And next slide. And you'll see you can send the postcard to anyone, right? And so it was a way to like start the conversation with women. And to the health department, this tool was in partnership with the health department. They paid for the printing and used these postcards across the state. Next slide. Somebody mentioned DC. This was one of the DC campaigns about being empowered. And they took a more traditional approach. When I see this, it just reminds me of like the Nefertiti, and speaking about women being queens as they take care of our sexual health. Next slide. Okay. Now this is it's more recent, also one of my favorites. You will notice that the images, I'm speaking to the health department now, the images there was from the She's Well campaign, right? From CDC. So they couldn't get approved other images, so they took what they already had. We know if CDC did it and it's approved by CDC, we could use it. And they call their campaign Mahogany Blue. Why Mahogany Blue? The pill is blue, right? Our first PrEP pill is blue. Why mahogany?
I would also say the lakes. Michigan is known for all of their lakes, blue water.
Mahogany's brown. What else? Think this is Michigan. The State Department is in Detroit.
Majority Black folks live there in Detroit.
You right there. Diana Ross.
Oh.
Right? So their native daughter, a play. And why am I mentioning this? Because we can use what we have, right? We can use what we have. We can't wait on a national campaign. We're going to have to use what we have. So they took images that were already used or approved by CDC, and they turned this campaign into their own, the Mahogany Blue. It's almost a year old, and they've done some amazing things with it. Next slide. All right. In the 2 minutes we have left, what questions do you have?
I just want to go ahead and mention the comments that were in the chat as well. So we had a comment that said, as parents, family members, we have to take off our judge robes and talk with our children and young adults to let them know we are here and we hear them and we can have conversation with them about every and anything. And then also there was a comment that said, so true. And then a resource was also dropped in the chat.
Thank you for that, Quenisha.
I'll make sure everybody in the room gets these in our follow-up because Ms. Leisha graciously granted us permission to share the content. So this will be available and sent to everybody.
Okay. Y'all still with me? Okay. So I want to do my own evaluation in 60 seconds. Just one word. Because you could have chose anybody, but you chose me to come and be with you. And I never, ever, ever take that for granted. So just one word that describes how you feel right now after this presentation.
Rejuvenated.
Yes, yes, yes. Okay. All right. Thank y'all.
Empowered.
You know, who told y'all like that's my word, right? Like that's my goal.
There were several empowered. Well, I guess you can see it on the screen too.
Yeah, because sometimes you just need to know you're not in this by yourself. It is so easy these days to get discouraged because we hear more no's than we hear yes. And all I'm saying is go back, retool it, reimagine it, use what you got, and get the yes. It's some women dependent on you. They waiting on you, and you're the one that's holding what they need to remain free from HIV. So thank y'all so much.
Thank you.
Okay. Elizabeth, I emailed you the billboards that we have around town, the Know Your Status campaign.
Thank you
Stuff on
so
YouTube
much.
right now. So I will look at it. Cool. Thank you, Miss Leisha, for joining us. I know this was a travel for you, but it also kind of, from my understanding, brought you to a state that's important to you. Also, a huge shout out to Carrie. She's with us online, my manager. Thank you so much for connecting me with Miss Leisha for this presentation. It was awesome. Again, I feel very, all the words that have been mentioned, and thank you everybody who joined us in person and virtually. So with that being said, I think we have the room for a little bit, so if there are any burning questions you have, please feel free. But other than that, the only other mention I will mention is, this coming month, so June 18th, we will have our quarterly coalition meeting. This is where, of course, stakeholders come together and we discuss structural change objectives and what we can do to make a change for us here in Memphis. If you haven't registered, we're going to be releasing the flyer and the link here shortly, but I challenge everybody in the room and anybody who is virtual that can join us here in Memphis. Please come.